y'all, what's going on? This is Jackie Marie, and today I am making a video titled What is the difference between a hospital unit secretary and a medical secretary? So, a hospital unit secretary basically you just provide support for a specific unit. So, whatever unit you work on, um, I worked med surge. So, if you work med surge, you only provide support to that unit. So you will manage the patient's records, you will answer questions from visitors, you will assist the physicians with necessary documents. So if a doctor is looking for a certain form, you would assist them. You basically perform the administrative tasks related to that unit. Now, sometimes you can do more. And what I mean by that, because most of the time you're at the nurse's station, and you're dealing with the patients, visitors, doctors, co-workers, but there are times you may be given more responsibility and you may um, do more administrative work, meaning you assist the director or the manager of the unit with doing things like helping with payroll. Like you won't necessarily see your coworkers pay. You would just see their hours, make sure their hours are in. You may order supplies for the unit. So, um, on the med surge floor when I worked, we didn't do any of that. We didn't order any of the supplies, but and we didn't order any of the pantry supplies either. So anything that went in the pantry, like the juices and things like that, we didn't order that on the med surge. But when I was in ICU, we didn't order the supplies like stuff for the clean utility, the supply room. We didn't order that, but we did order stuff for the pantry. So you may be given more responsibility on the unit. It just all depends on the unit. So you may do more things than just, deal with the doctors and things like that. You may do more, and that's what we did. That was the difference between the med surge, the tasks that we had, as opposed to the ICU. We had more tasks that we did. Now, a medical secretary is usually like a secretary that works in a doctor's office or clinic or something like that. And they provide administrative support for the entire facility. So if you go to a clinic, you have a secretary in the front. They may schedule appointments across different departments. So, like, let's say you go to the doctor and you see the doctor, and then the doctor says, okay, I want you to come back in 2 weeks and have a ultrasound done. So that secretary will schedule that. They will also, and then like they may also schedule one for radiology, or something, just different departments. If so, they do that as well. And then also they process patient forms throughout the facility. So like when you go to the doctor, you check in. They take that information, they fill it out. They may process payments. It just all depends. They may take your copay, um, or some they take it on the back end when you're leaving. They take the payment. It just all depends. But it depends on how the doctor set up. So like my doctor, when I go to the doctor, I have the check in, and they take the copay, and then but once I see the doctor, they schedule. It's another set of secretaries that schedule the appointment for the follow up, or if I need to go back and have a procedure done, they'll schedule that. So it just all depends on how the facility is set up, but that's usually what a medical secretary is. A medical secretary can run the entire facility. It just all depends on how they have it set up. Some maybe some, you know, you some secretaries may just have this specific, and then some may have they do more. It just all depends on how the facility is set up. Now, if you want to learn more about being a unit secretary, you can pick up a copy of my book on my website. Just click the link in the bio, and I'll talk to you later. Bye.